Okay. Hello, hello. This is Dr. Susie Gransky here, coming to you live. I'm so glad for those of you that can join me today. Thank you so much for being here. And for those of you that don't know me, I'm a doctor of physical therapy that specializes in pelvic health. I've been specializing in pelvic health for the past 5 years, with the last 3 years really focusing an emphasis on men's health, especially men's holistic pelvic health. And I get asked a lot, well, what made you decide to work with just the dangly bits? And the reason for this is a lot of guys that were coming into my office and finding me really wish to have a resource like me earlier on than later on. And if you are suffering from pelvic pain, you know quite well that it can be years, months, weeks before you get the appropriate care that you need. Oftentimes in the conventional medical system, when a guy has pelvic pain, they don't know who to go to. They're scared. They don't know who to see. Women have a gynecologist that deals with their reproductive organs. But guys, they really don't know who to go and what to do or who to see. So having resources that will clearly help them navigate through pelvic pain is one of my main goals, to really get pelvic pain before it starts to catastrophize your world and snowball into something that's a little bit more than one can handle all at once. And pain in general is no fun, and no one really wishes to have pain to themselves. But what I'm trying to get with this webinar today is to really help you understand what pain is, how does pain work, and what you can do to navigate your life through pelvic pain. And by doing this is just educating you and giving you an understanding of what your body and how your body works. So that's the nutshell of today's webinar. So it's the nuts and bolts of treating your pelvic pain. And the first thing with that is education, and educating yourself about what pain is and what you can do to minimize an extra sensitive nervous system. So I'll have some slides that are going to be posted up. You won't see my face, but you'll see the slides. So I hope you can follow along. And there will be about 5 or 10 minutes for question and answer. If you have a question that you want to ask, please type it in the Q&A box. You can choose to leave your name. You can choose to do it anonymously. I will respect it either way, and we'll get to it at the end of the webinar. All right, hope you guys enjoy it. Let's share my screen. Okay, so the nuts and bolts of treating pelvic pain. I love this picture. No pain like this body, and nobody like this pain. I'm sure that goes for many of you who are suffering with pelvic pain. And as I said earlier, pelvic pain, no one really wishes to get pelvic pain. No one really wants to get pelvic pain. They don't say, hey, come here and get me. But it gets a bad rap. And I think we're often told to really avoid pain, be scared of it at all costs, which really makes us a society that's super hypervigilant and overly protective. And that makes us really afraid to take risks, explore our boundaries, our limitations. And it essentially makes us intolerant to change, to anything that's different. And I'm guilty of it too. We freak out when things don't go our way, or we avoid things that are unpleasant. For example, like pain. We try really, really hard to eliminate it and get rid of it because really it gets a bad rap. But we have to realize that nothing is ever permanent. Your body is constantly changing. The environment around you is changing. Your cells, your tissues are constantly changing. So the fact that everything does change really should put your mind at ease that pelvic pain isn't going to be permanent. It is not a permanent condition. It is not a disease. You are not broken. Okay, it is kind of like having, an asthma or cold. It is actually as frequent as having asthma or cold or little niggles, aches and pains here and there. The reason why there's a lot of purchase and a lot of hype around our pelvic pain is because we're dealing with our genitals. And when we're dealing with our genitals, there are lots of thoughts and beliefs and how we feel about this part of our body that really amps up our nervous system and amps up our awareness to what's happening in this part of our body. So I want to go on explaining that to really help yourself get out of pain, you have to understand what pain is, how it works. And literature and research has really shown that educating yourself about how your brain and body function together with hands-on approaches, physical therapies, acupuncture, massage, whatever floats your boat, all of those things will help ease your pain. So let's start with explaining what pain really is. Pain is both a physiological and psychological experience. It's a feeling like happiness, anger, joy, frustration. So pain is a normal part of life that everyone experiences. Pain is in response to, now hear me clearly on this one, an actual or a perceived threat. So you can experience pain to an actual threat and or a perceived threat. And like I said before, no one really wishes for pain to come knocking on their door, and we often don't choose when or how pain gets here. But you do have a choice how to react to the current circumstances that you're in. This is important because you'll learn in just a little bit that thoughts, beliefs, values, fears, etc. can and will trigger physiological reactions in your body that can either help you or create more suffering for you. So I'm sure we've all experienced episodes where, our boss pissed us off, we had a fight in our relationship, someone tells you something that you really don't like to hear. What happens to your body when you start to get agitated or annoyed or sad or depressed? You probably felt something like tension in your shoulders, tension in your jaw, a headache coming on, your abdominal muscles are gripping, your heart rate increases, your breathing becomes more shallow. So those are actual physiological reactions that are happening in your body, chemical processes and nervous system processes that are happening in response to thought processes, sensory, emotional, and psychological input. So my question next is, well, if our thoughts, like beliefs and values and fears, create physiological reactions, why create more mental suffering on top of the physical pain that you're already experiencing? So what causes pelvic pain, or any pain for that matter, right? It's a lot of issues. And what I tell my patients is that sometimes it is the perfect storm. It's a mix of the perfect storm. When we experience pain or disease or illness in our life, it usually doesn't come, when you wake up in the morning, it comes out of nowhere. Oftentimes the body is trying to tell you something, whispering to you, giving you little signals. It's kind of like your check engine light, of your car. You're driving, the light goes on, you're not really worried about it. Months go by and all of a sudden you're stranded on the side of the highway because you didn't pay attention to that check engine light. So the body actually responds in the same way. I mean, it's not like your car, of course, it's actually much more complex than a car. But you have to understand that when we get pain or illnesses or disease, it usually is an accumulation of things over one's lifetime that predisposes someone to an illness or a pattern or pain for that matter. So it's multifactorial. It can be stress. It can be a combination of trauma that you've experienced in the past when you were a child, recent trauma, infections, getting sick, having a virus, having strep throat or mono, diet, your lifestyle, failed treatments and fear. So those are all contributing to your experience of pelvic pain. And so my message here is that although you are experiencing pelvic pain at this time, it is not permanent. And remember that everything does change. And I don't think that we can ever recall anything that doesn't ever change, right? Like we all get old. Flowers grow and then they die. We constantly are changing stuff in our house. So, our bodies kind of work the same way. So nothing is really permanent, and you have more control than you think over the pain that you're experiencing. The concept of pain not being just in your head, I've had many patients tell me that a lot of their doctors will blow them off or say, it's just all in your head. You need to relax. It's easier said than done. And the fact that, it isn't all in your head, like you're not just making it up, you're actually feeling a physical symptom. However, the brain does play a huge role in the perception of that feeling. Remember, pain is a feeling, not a thing. And lastly, I don't want to burst anyone's bubble, but there is no quick fix. The forums that I'm part of and the guys that I see that come in my clinic, they really are desperate for that one thing that's going to solve their problem. And I'm here to say that there isn't a quick fix, a magic button that we can press to help pain go away. Obviously, if it is something like an infection, an STD or something like that, I mean, even those are asymptomatic sometimes, because guys will have an STD but have no symptoms, right? So it's really more complex than we think on the surface. But what I'm trying to get at is sometimes this pain is not just in the tissues. It's a combination of what our brain is telling our body and what our body is feeding back to the brain. So understanding that there are no quick fixes, and that patience and persistence and loving kindness to yourself will really allow you to overcome this pain and have some gentle acceptance of what's going on, and know that it will go away. You just might put a little bit of effort and self-care into changing maybe some things in your life. And what that is and what that looks like is entirely up to you. So, okay. Hopefully I'm not going too fast. All right, I love this. How does pain work? And this is Homer Simpson. No brain, no pain. And this is really kind of true. Sometimes you have tissue damage and have no pain. And a great example of this is, have you ever had a bruise? Like you wake up in the morning and you find you have like this huge welt or bruise on your thigh or your arm, but you don't know where it came from. Well, that's a clear example of, there's tissue damage, but you have no pain. You didn't even know that happened. So how does that work? And where does that come from, right? So pain scientists like Dr. David Butler and Laura Mosley, they have been studying pain science in humans for decades. And they concluded in their research that pain is produced 100% in the brain. It is meant to really protect you. So moving away from pain as danger and bad to pain as a protector and not a danger. It's the brain that's processing the information that you're receiving from your world, and it's allowing you to pay attention to something. It's meant to grab your attention. So here's how pain works. Let's say, for example, you step on a nail. There are danger detectors in your skin and in your body, in your joints, and your muscles that send signals to the spinal cord. And those signals are meant to communicate the issue that's happening. And again, you don't really know if this is bad or not until this message goes up to the brain. So chemicals are released at this level, at the spinal cord level, to further communicate locally and up to the brain. Once the brain receives the signal and analyzes the situation, so it's analyzing, okay, do I have a car coming at me? Do I have to get out of the way? Is there, what's sticking in my foot, this nail, right? So the brain has to give you a signal to pay attention to the thing that's happening around you. So once the Rolodex in the brain kind of goes through all the memories and all the fears and analyzes the situation and says, yep, you're in danger, you've got a nail sticking out your foot. It sends a signal back down, letting you perceive pain. So reflexes happen, you quickly remove your foot, you lift your foot up and sit down so you're not pushing the nail further in your foot, that sort of thing. And then all these chemical processes start to happen. You start to have swelling, histamine, and inflammatory chemicals are released so that it doesn't hurt so bad. Again, your brain is releasing its own drug cabinet of drugs so that it can minimize the impact of the pain that you're feeling. And then once you go to the ER, you know you're going to be good. They took out the nail, they wrapped your foot in a bandage, and the threat has been removed. The brain feels pretty safe. You took care of it, and the pain response comes back down fairly quickly. Now, that tissue, that nail that went through your foot, that usually takes about, can take anywhere from 8 to 12 weeks to heal. And tissues heal, right? You get a paper cut on your finger, or you get a cut on your hand. You're not staring at it and wishing for that cut to heal. Your body automatically does it, which is pretty freaking amazing, if you ask me. And the same thing happens to any tissue in our body. It generally heals on its own. But it's been said that 1 in every 3 people, pain lingers on well after tissues have healed. It's very interesting. And scientists have asked, well, why does this happen? So remember all those things that can contribute to you having pelvic pain? Well, those things can also contribute to why the pain persists. For example, failed treatments, what you've been told. And what you've been told can either be a safety for you or can be a danger for you. For example, a lot of patients that have back pain I see, they'll bring in their scans and people will tell them, oh, your back is all jacked up. But in reality, if you scan a majority of the population, they all have issues with their back, and their scans are not perfect. There is no perfect scan. But a majority of them also don't have pain. So again, we have to question, does the scan really tell us anything for that matter? It certainly doesn't tell you why you have pain. The other thing is what you tell yourself. So things like, this pain is never going to go away. I'm broken. My relationships are going to be ruined. How am I going to tell my partner? I'm not normal. There's something more serious going on. What if it's cancer? And that sort of thing. And all of these things are perpetually ruminating and playing around and around and around in our heads all day. And when we're distracted, we're really not paying attention to that. But once we quiet our minds, like in the evening time or we have some downtime, then these messages become louder and louder, obviously, because you're not distracted. So what other things might be keeping you in pain well after tissues have healed? Scans, we talked about them. Scans could be pretty scary because, oh my gosh, I didn't know this is what things look like, and should I be freaked out about it? Family issues and stressors at home, work stress, anxiety, worry. A lot of the guys that I see, I don't want to stereotype anyone, but most of them are very type A personalities, very anxious, driven, hardworking, and there's nothing wrong with that. It's just a matter of how that is impacting your pain response. And stress doesn't have to be a bad thing either. It's, again, how we respond to stress. And they've done a lot of studies to show that they took a group of people that had a lot of stress and they separated them into 2 groups. And one of the groups was, people who have stress that really think that stress is bad and they don't handle those stress very well. And then the second group was a group of people that thought differently about their stress. They actually thought it was positive, that they enjoyed it. It was a motivation for them to succeed, et cetera, et cetera. And they found that those that responded to their stress in a negative way and were not able to cope with it in a more healthy way had more risks for illness and diseases such as cancers, chronic pain, fibromyalgia, chronic sinusitis, you name it, autoimmune diseases, versus the other group that took a different perspective of their stress. They were less likely to suffer from disease or illness or pain. So again, very interesting stuff that people have been putting together from a research perspective. So you name it, you fill in the blank. Everyone is very unique, but there is always a why to why certain symptoms are not leaving us, right? So let's talk about these triggers. And we need to figure out what's pushing your buttons and not letting you kind of live a life without pain. So all of these things that you see here can either be a safety or a danger. And the things that are a danger, or that you categorize as danger, that it's unpleasant, it's an unpleasant feeling, it makes you feel anxious, it makes you feel scared, worried, really heighten your awareness and increase your nervous system to be super sensitive. So your alarm bells, your protective response is going to be hypervigilant. It's going to be heightened, and the threshold, the amount of wiggle room you have before the alarm bells go off, is smaller than someone who doesn't have pain or sees or is not afraid of it. So some of these triggers can be, again, we talked about these thoughts, worries, anxiety, emotional stress. You hate your job, you're in a bad relationship. Sounds can even be a danger, like, hearing scans go off, or, a car door slamming, people in an argument, that sort of thing. Smells can be a danger. What others tell you, what you tell yourself, and not feeling supported or listened to is another huge trigger for a lot of men who suffer from pelvic pain, because they've often been told that there's nothing that can be done for their pain. So what can you do to lessen the impact of the danger triggers, right? What can you do to lessen some of these triggers? And really the goal is to calm the nervous system down, because the nervous system is ultimately what controls muscle tone, what controls your reproductive organs, your digestive organs, and really it allows you to move and to process your environment. Without the brain, everyone would be vegetized. So it's really important to understand that it's a nervous system and neurological response that's happening in response to these triggers that you might be experiencing. So let's start feeling better, right? And again, I know how frustrating this can be, and I know that we, as a human being, we want things to happen like yesterday. Trust me, I've been there, I've been in your shoes, so I know how that feeling is. But believe me and trust me on this one, that once you start to just accept the present moment for what it is, the amount of resistance and the amount of stress and the amount of worry and the amount of anxiety starts to lessen, ultimately lessening your pain response. So how do you start feeling better? Well, I like to use the recognize, reduce, and eliminate strategy. And the first step is recognizing and bringing awareness to what your triggers are. What are some of the fears and the false fears that you keep telling yourself? What are the thoughts that keep ruminating in your head? As Brene Brown wrote in her book, she wrote, dress rehearsing tragedy. We are notorious as a species to constantly think the worst, right? We always think that, oh my gosh, this is cancer, this is an STD, and I have no idea, and they're just not finding it, or it's the end of the world kind of thing. And as you remember from what I've told you before about the pain physiology and the pain science, that these thoughts, these fears, the things that you tell yourself, the things that you surround yourself with, again, in this rut, it will be very difficult to get you out of it, and it will only make that pain signal stronger, because pain neurons love a party, and they'll start to network with other neurons in the brain to reach out to other parts of your body, which is why sometimes some guys will feel pain that like jumps around. They'll feel like, well, it's in the tip of my penis, and then it'll go to my butt, and then it'll be like in my bladder, and then it'll go to my buttock. And so that tells me in itself that it's not just in the tissue, because it's nearly impossible to have all of those issues, the tissues in those issues. It's the brain kind of playing tricks on you. And so we have to retrain the brain, because if you can train it to go this way, you can certainly retrain it to be much calmer and to deconstruct some of the neurons and the circuitry. So it's really fascinating, but it works. So once you recognize your triggers, your fears, the thoughts that keep going on, then you can start to reduce them. Obviously, if you don't know or you're not aware of things that go on in your head, what you're exposing yourself to, what really pushes your buttons, it's going to be really hard to make a change or do anything about it. So you need to recognize it, then you can start to reduce it. And reducing it can be a number of things that you can implement, right? You can implement journaling, you can implement diaphragmatic breathing. You can remove yourself from situations that make you fearful or more anxious. Mental coaching and mind-body mentoring helps to reduce that. Having a coach, having support system to just reinforce safeties within you. And that's what I would recommend is, jotting down what is a danger for you, what's a trigger, and what are some positive triggers, because it's not always about the bad. Maybe start with the good. What makes you feel good? What makes you feel happy? What brings a smile to your face? What, like a good distraction? What are some of the foods you like to eat? Who do you like to hang out with? What do you like to listen to? Do you like to draw? Those sorts of things. And once we start to associate more of a safety around your sexual parts, your unmentionables, then the protection from the brain will not have to be so fierce. The brain will start to calm down and say, oh, this is no longer a danger. We're not being threatened. I can calm down. And that's a process in itself. It is seriously a process. And then eventually you'll be able to eliminate the feelings that you're feeling. So recognize, reduce, and eliminate. Part of recognizing and bringing awareness, and the part of to reduce the pain that you feel and really to eliminate it, is the key concept of acceptance. And it's a concept that many people, it's super logical, right? It's like, okay, I can't do anything about it now. And theoretically, we know that we to some extent have to accept what's happening to us because we really can't control the external environment. Like, I said earlier, we don't choose to have pain knocking on our door. We're not just like, yeah, hey, come on, let's have a party. So there has to be a certain level of acceptance. The harder that you push, the more that you will mentally suffer. And we know that the more mental suffering you have, the more physiological responses from your body, the more your body's going to be feeling it as well. Embracing change is something that goes with acceptance. Knowing that nothing is forever and that you're constantly changing should really let you sleep better at night, honestly, and really knowing that pelvic pain isn't permanent. And to really help you understand this and to bring maybe some of this emotional work to acceptance is asking yourself, why is this pain in my life right now? But don't judge yourself and don't criticize yourself. Don't think you're stupid. Don't think you're broken. Don't think there's something wrong with you. Don't think that you're not normal. Really sit down with that question and ask yourself, why is this pain in my life? Is there anything positive that I can take out of it? Because believe it or not, out of all tragedy comes something positive. So it might be that message that your body's trying to give you to slow down. Something maybe has to change in your life. Maybe you're not feeling creative. Maybe you're in a job that you hate and you need to change it. What is it that you're holding on to that is creating more suffering for you? So I know that's a little deep and hopefully not too woo-woo for you guys, but I really do find that the guys that understand the emotional work that has to go into healing yourself from pelvic pain, they do so much better. They don't have to see me as much. They come in maybe once every 2 months just for a little pep talk, a little mentoring, when honestly the context of their life is chaotic. And the context of your life and what's going on around you in your storybook is really what is underlying why disease or illness or pain, for example, is coming into your life. So again, hopefully that's not too woo-woo for you, but it is an important thing that I really want to push home with you guys. Self-care. So, okay, I'm not just saying, all right, sit there and meditate all day. Educating yourself about your pain and doing physical exercise and body work is important. So self-care, what does self-care look like? What is the prescription that you need to write for yourself to get better? Maybe you need more fun in your life. Maybe you need a weekend with your buddies. Maybe you need to paint more, to draw, to listen to music. Some people like to write. What is it that you need in order for your body to heal? And sometimes that is a multiple factorial contribution, right? Physical therapy, obviously I'm a physical therapist. So physical therapies, hands-on care, and really how to understand treating your own body and being comfortable with treating your own body is key. And to do that, you have to feel confident that you're not hurting yourself. Because again, that's a sneaky little thought that will sometimes creep up on my patient's mind saying, I don't know what I'm doing. I don't want to hurt myself. And so then you don't do anything at all. So I think educating yourself on your anatomy, on your body parts, what it should feel like, having somebody touch you there and point out some of the things so that, again, you can recognize, you bring awareness to the situation so that you can reduce it, and you can reduce it with your own self-treatment techniques. Acupuncture also has been shown in the research and literature to be very, very good in terms of chronic pain, autoimmune diseases, calming down the nervous system, and in addition to a whole lot of different things. I'm not an acupuncturist, but it has been proven in the literature to help quite a bit. Mind-body coaching and mentoring. A lot of the things that I do with my clients in my online course that I have, the Men's DIY Pelvic Pain Program, in addition to learning how to figure things out, figure out your body and explore, and then how to treat yourself, there's an aspect of this mind-body coaching and mentoring to help increase your mental resilience and reduce harmful unwanted thoughts. Again, it's not that easy to say, oh, I'm just not going to think about it, because subconsciously it has been already wired, neurons that fire together wired together. So it's kind of like that electrical impulse, and we have to slowly deconstruct the sandcastle that has been created in your mind around the pain that you're feeling. And the genitals, your penis, your testicles obviously have a great purchase in your brain. This is your sexual health, your sexual activity. And in a world that we live in today, it's not very, hearted, how do I say this? It's not really lightheartedly embraced, because there's a lot of stigma around our private parts. And sadly, we're taught to be ashamed of them and to not talk about them. And it's kind of not like how it works. So I think, being comfortable around that and doing that mind-body mentoring will really help increase your mental resilience, which will also help increase your physical resilience and calm down an extra sensitive nervous system. And I talked about self-care, having fun, exercising. You won't hurt yourself by any means. Exercise decreases pain, has been shown for decades now that motion is lotion. Expressing your feelings about what's going on. Again, songs, writing, talking it out, painting, whatever that looks like for you, but definitely get it out and cope with it in a healthy way. And being present with your emotions when you are talking about them and expressing your feelings. It's not about just spilling your guts to the shrink. Some guys are like, well, I'm not crazy and I'm not depressed and I don't want to go see anybody. And it's not about that at all. It's about increasing your mental resilience and to help retrain the brain to feel safe and comfortable within your body, to accept the present moment, again, without judgment, and to calm your nervous system down and lessen the signal to the area that you're feeling pain in. And lastly, I'm hitting the nail on the head here. Repeat, repeat, repeat. Practice makes perfect. Give yourself time, give yourself patience, love. Consistency is key. I kind of tell my patients this all the time. It's like a waterfall. Whenever you're transforming and trying to do something, you have a really heavy downpour and the waterfall goes gushing down. And then after the rainfall, it just trickles and it kind of dries. Some of these waterfalls are not even waterfalls and it trickles, versus a flowing stream, a really wide, broad river that is always flowing and never ending, right? That's how you should approach healing yourself. Not an all or nothing thing, but a slow and steady journey that sometimes you'll have more of a high tide, sometimes you'll have more of a low tide, but you're always flowing in a forward direction, okay? And lastly, and I've already talked about this a little bit, so I apologize if I'm being redundant, but it's going to be okay. You are going to do great. You're not going to have this pain forever. So let go of the rope. Let go of the rope, guys. Sometimes holding on is worse than letting go. So you have to trust your body that it will heal. Give yourself what it needs to make it happen. And don't let fear drive your decisions. We can't stop pain from knocking on our door because it's really a normal part of life to experience pain. But we can choose how we react to it, which will also help you lessen your pain response. So being frustrated and being angry and impatient only adds to mental suffering, to the physical pain that you're already experiencing. And that will make it hard for healing to take place because, again, your body is in a fight or flight mode at that point. It's in a stressful response. And healing is going to be quite difficult to happen. And you need to be in a very calm and restful and rest and digest mode for the nervous system to really feel safe to do its thing. So remember, as my mentors have said, and I mentioned their names in this webinar, but Dr. David Butler, who's the author of Explain Pain, which I recommend everyone reading. That is a wonderful read for anyone in pain, and all my patients, it's their homework. So Explain Pain by David Butler and Dr. Lorimer Mosley. They have a wonderful mantra that says, remember, you might be sore, but you're safe. And hurt doesn't equal harm. So thank you so much for being here for the webinar. I know this isn't a topic that's super playful or lighthearted, but hopefully you've learned a little something and took away some clinical nuggets. And ultimately, at the end of the day, I hope you found some hope in your situation. Never give up. So keep carrying on, my friends. And I'm going to stop sharing my screen right now and leave room for question and answers. So if you guys have any questions, feel free to type them into the Q&A box and I will answer them live for you. So we have a question in the Q&A box by a participant, and he asks, is pain a different sensation? So I'm going to answer this live. Pain is a sensation, and it could be a sensation dependent on totally different factors. Like, for example, you have a warm needle, right? For example, you have a warm needle and it touches your skin. If it touches my skin, I might experience it in a different way. And that could be based on several different things. Have I ever felt something like this before? Do I know what's touching my skin? Is it penetrating my skin? You know, am I a person that's really afraid of things, you know, touching me? Am I super sensitive about things? So I might experience it differently than you. So your pain experience or your feeling or sensation that you're experiencing can be quite different from the next person. And only you can describe what that sensation is to you and what that means for you, because it fluctuates. It can go from here to there. It can be stronger one day and it could be barely there another. So there's a lot that the brain has to process and kind of analyze, and then it spits back out a response. But this happens like so fast and so quickly. Again, we don't have time to sit there and think, oh, I got a snake biting my leg, let me analyze the situation, right? So I'm like kind of like super simplifying it, but these processes and these messages happen like lightning, super fast. And a lot of things can shape your experience. So hopefully that answers your question. So he followed up with, is it like a burning or dull? It could be. It could be, yes. It could be achy. It could be burning. It could be dull. It could be itchy. You know, nerves can itch as well. It could be throbbing. It could be aching, sharp, shooting, you name it. Some people, you know, they'll have pictures in their head or images that they'll describe to describe their pain. And to be honest, you're not alone when a lot of guys just can't describe it. You know, it's hard for anyone to describe the sensation that they're feeling in their body. So they'll use metaphors. They'll use things like, it feels like a hot prod poking me in my ass, you know, that sort of thing, because it's so hard to describe the sensation that we're feeling. And that's, again, for various reasons and complexities of the nervous system and the brain, and then the way the immune system works with the body, because there's a lot of different physiological processes that are happening when you're experiencing pain. Because, again, it is a feeling, very much so, like joy, happiness, frustration, and anger. And those things go away. So the potential for the quote unquote pain feeling that you're feeling can also go away. So hopefully that answered your question. Oh, he said, thank you. That helped a lot. You're welcome. You're so welcome. So I'm just going to double check on this one question. Oh, okay. Oh, he just left us. Okay. So it doesn't look like we have any more questions. So I won't take up more of your time. I really do appreciate you guys being on this webinar with me. And I truly wish you all the best on your journey. And it is a journey. So be patient, be kind to yourself, love yourself. This too shall pass, just like everything else does. So stay strong, my friends, and I will see you next time. Oh, before I forget, please do check out the online DIY pelvic pain relief program that I have. It is, you know, I'm not tooting my own horn, but it's awesome. There's nothing like that out there. It has really live dangly bits, so you're not just going to have a plastic model. It's a real human being that's my model, and I'm pretty much showing you exactly how to assess yourself, evaluate yourself, and treat yourself. And then you have the mind-body coaching and mentoring from me as an option as well. So I hope you guys consider that if that's something you're interested in. And of course, you can always come and visit me in Asheville, North Carolina. I'd love to see you. And we can really work on making your life super better and back to where it was. All right. So thank you so much for being here. Until next time, friends. Bye.